This is Benjin TV. My name is Udoka Juliet. Welcome to our conversation on COVID-19 pandemic. So, what are the health implications of this lockdown?
The health implications are many, because right now a lot of people are not going to work, and because they are not going to work, they sit at home, and by sitting at home, most people get the body activities they need through their work, going out and all that. So right now a lot of people are just stagnant.
Yes.
And by that their body too becomes kind of stagnant, and it has a way of affecting the organs. Yes, except the person maintains a high a kind of a level of exercise to balance the number of hours the person stays idle. Without that, a lot of people will run a high health risk because of not going out on daily basis, and also the mental stress too, because a lot of people used to go to work. Your body is already used to that activities. Suddenly you are asked not to again, so it is more like shutting you down, and definitely it has a lot of health implication. But we can support that, we can help that through physical exercise and some mental exercise too. Yes.
Okay. So, how can we help people in this lockdown?
The only way we can help people is first is trying as much as we can to provide food for those who cannot provide for themselves, because the thought of not having what to eat kills faster than anything. When you wake up in the morning and you don't know where your next meal will come from, it kills faster than the hunger itself. So we can help a lot by doing the little we can, by providing for those who cannot provide for themselves. Then this time also is a time to give hope to the hopeless.
Yes.
Because right now a lot of people are disillusioned. A lot of people, the churches are shut down. Initially, a lot of people find consolation when they go to church, but right now even those churches are shut down.
Yes.
So most people are so disillusioned that they don't know what next to do. So the best way to help people right now is to constantly give message of hope to them, making them see the brighter side of the whole pandemic, the whole lockdown and everything, so that the hope will sustain them till the end of the whole shutdown, and life begins to get back to normal. So the much we can do to people, if we have the means, provide food for them, constantly give message of hope, then more enlightenment. Most times, in fact, fear, ignorance moves along with fear. But when you know what you should know, and this time around we have a lot of misinformation, going around, people saying so many things,
True.
So this time around it's time to give hope to people, make people see the brighter side of life, give them food if you can afford, then take care of the sick, those who are, let's say, in state of disillusionment. Try as much as we can to clear their doubts and make them stay positive.
Yeah.
That's the much we can do for people right now.
Okay. So, who are the people at high risk of this lockdown and COVID-19 pandemic?
Majorly, everybody is at risk. But then, based on most of the statistics we see, we discover that aged people are more at high risk because it's a respiratory disease. People above 60s, 70s, 80s are more at risk. And also we discover that children below the age of 1 year are also at a very high risk, because at that stage their immune system is still developing, and this virus is an immune battle. So those children below a year are still in the process of immunization and immune formation, so they have a higher risk. Then those people from 60 and above are also at a higher risk, because of most of them have started having some health challenges, and age has let's say weakened to an extent their immune system. So those people will need a higher protection, and will need to take more precautions than the other middle-aged. But not that. And then also those people with history of maybe previous respiratory disease like tobacco, people that have suffered tuberculosis or asthmatic or those respiratory related diseases, they are also at high risk. So those people should be watched out for, and people like that should take more precaution so that they don't come in contact with it. It's not that anybody is good to have contact with it, but those ones are at a higher risk. Yes.
Thank you very much.
You're welcome.